Hello, I'm Dr. Edward Hall, and I'm here to talk to you today about age-related macular degeneration. Age-related macular degeneration is a disease that primarily affects older people, usually over the age of 50. And there are several risk factors for macular degeneration, including age, but also genetics. Smoking is the most modifiable risk factor. So smoking actually increases the risk of macular degeneration by about 350%. Diet and exercise and good nutrition can help delay the onset of macular degeneration. But I want to step back for a minute and really talk about what is macular degeneration. So I like to tell my patients, think about your eye as being like a little camera, and the retina is a bit like the film. So when you look at something, the image focuses onto your retina at the back of your eye. The very center part of your retina is called the macula. And we have a graphic here that will help us to understand that a little bit better. So this is what the macula looks like. And in people with macular degeneration, as clinicians, we start to see these little spots of deterioration of the central retina. And that's usually characterized by what we call drusen, which are small deposits under the retina, and pigment changes. So just like our skin has pigment, the retina also has a pigment layer underneath to help absorb light. In more what we would call intermediate stages of the disease, as depicted here in the center, you can see that these areas start to become more prominent and more easily visible. And then in a more advanced form, you could see that there's actually a loss of some tissue here in the center, as depicted by that yellowish circle. And the red would indicate blood vessels which underlie the retina. So those blood vessels now become visible since the retina and the pigment have deteriorated so much. So having dry macular degeneration is like, again, going back to the camera analogy, it's like the film is deteriorating over time. So in early or intermediate stages of the disease, we just say someone has dry macular degeneration. Nowadays, people are talking more and more about something called geographic atrophy. So geographic atrophy is depicted in this model, and that is when the disease reaches a stage where the atrophy or thinning becomes so prominent that there are actually geographic-like areas that have been lost. The reason why people are talking about this more and more is that in the last few years, treatments have emerged to treat geographic atrophy. Unfortunately, these treatments don't stop the progression of geographic atrophy or macular degeneration, but they do slow the disease progression. And so that's important. If you're considering treatment for geographic atrophy, it's important to discuss with your physician whether or not you're a good candidate, because not all people with macular degeneration will be good candidates. There are also certain risks involved with these treatments that should be considered as well. So if you have very early geographic atrophy or very late geographic atrophy, you really may not be a good candidate for these treatments. In summary, dry macular degeneration is a disease characterized by gradual thinning of the retina, whereas geographic atrophy is a disease process which represents a more advanced stage of dry macular degeneration. There are discrete areas in GA where the retina is completely lost. In these more advanced stages, treatment may be warranted with injection therapy or continued use of AREDS 2 vitamins. But in all cases, we do recommend the use of AREDS 2 vitamins for people with dry macular degeneration. In conclusion, it is important to see your retina specialist to make sure that you are getting the most appropriate care for dry macular degeneration. Thank you.